You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. My first guest says no more dentures, that nobody should be wearing a loose-fitting denture. And we're talking about dental implants today. With us, we have an expert on the topic, Dr. Eric Beckman. Dr. Beckman?
Well, thanks for having me on.
Good, good. I know you brought some models. We'll talk about that. Now, for people that don't know your practice, and you're a board-certified periodontist, like, who's the typical patient that you see? Like, what do you do as a periodontist?
There's a lot of different things. So our training, we really work on treating recession. So when you have kind of the gums are receding up and you're showing more root surface, and so you're going to get some cold sensitivity. Maybe it's not very cosmetic. So we have procedures we can do to kind of improve that, get that coverage back, and make sure the teeth look normal. Same way we do the other thing too, where if you have too much gummy, we call it a gummy smile. You smile up and you way too much gum showing. We can actually recontour that a little bit and change where the gum sits and show it to kind of expose your natural teeth and your natural smile. And then, of course, you know, today, well, actually, periodontal disease, one of the main things that we're trained to treat, gum disease. You know, people with, there's a lot of calculus and bacterial infections around teeth. Sometimes people will have bad breath, loose teeth. So what we do is we
bleeding gums is part of gum disease?
Bleeding gums is an indication of disease.
So that's when they have to go to see you guys.
Exactly.
The periodontist.
Yeah. And we have, you know, we try to do kind of more of a minimalist technique with laser therapy, which really helps improve that up, clear up that infection, stabilize the teeth become less mobile, more secure. The bad breath goes away, which is a great treatment. But I know today we're kind of here talking about dental implants and making sure patients have good options for having teeth back again.
So you've been doing this for 8 years. I mean, as far as dental implants, right?
You bet.
So when we say no more dentures at the top of the show, you believe that?
Oh, for sure. I really, you know, dentures to me are a crutch. You know, they work fine. And any denture patient will tell you it's fine, or most of them. But I think it's really a crutch that they're not happy. They're dealing with it. They're surviving with it. But it's not something. If you had a denture patient and you said, you know what, you can either keep your dentures or you can go back to where your teeth were when you were 20 years old, I would hope that all of them would kind of go back to the 20-year-old smile, and life would be a lot easier. They could eat whatever they want to, and they wouldn't have the difficulty with life, eating, chewing, social embarrassment. So
your role as a periodontist, so a patient that has like an upper lower denture can go in with you. And if everything works out, like 4 or 6 implants on the lower, get a full arch of teeth that either snap in, snap out, or they're fixed. They don't come in and out.
Correct. And there's lots of different options. And so, you know, with our practice, we want to make sure that the patient walks away with what they want. And so we do a lot of kind of conversations and get to know the patients. What do they really want? Most people would want to have a fixed set of teeth.
So in Denver, pretty healthy place. People are known,
really
active
healthy,
place. Are there really that many people wearing a denture?
Oh, yeah. I mean, in Denver alone, there's probably tens of thousands of people. I mean, you could easily fill up the Bronco Stadium, no problem, with all the people having...
The Denver Bronco Stadium.
Denver Bronco Stadium, for sure.
Like what, upper or lower denture?
Yeah, either one of the
then
two.
Why aren't
I mean, think about this. There's 35 million people nationwide who are missing teeth, either a lower or upper denture. And so, I mean, in the Denver area, there are plenty of people. And you wouldn't normally think, you know, just walking down the street, dentures are made, you know, cosmetically. They're not a great option, but they do, you know, fill in the gap. And so there's probably more people out there that have dentures and they're walking down the street with you that you don't even know about.
You say they can't eat and chew very well.
True. They're okay at eating and chewing, but it is a skill that you develop over time to how to chew with a denture. And then as those years go on, the denture does not fit as well. It starts getting loose. And so a lot of people kind of go towards, you know, glue, denture glue, adhesives to try to keep it in place so it doesn't fall out, which is a big problem with dentures.
So I guess dentures aren't attached to anything.
Correct.
Your idea is they should all be attached to something, like dental implants. Is that the future of dentistry?
Oh, I hope so. So like I said, no one really likes dentures. They don't really fit very well. Your diet, you're always having to kind of change your diet. Maybe you go to different restaurants just based on the food because you can't eat that hard,
like soft stuff.
soups, you can't eat salads, you can't eat carrots, you can't eat apples, you can't eat corn on the cob, ribs, and so they have to change their diets to really kind of fit that. Whereas, when you're 20 years old or you have fixed teeth, or if you have implants that hold the teeth in place and get you a full set of teeth, you can eat whatever you want to again, and very quickly too.
Okay, so if it's so good though, help me understand this. Okay, so if dental implants are so good, and there's so many denture wearers, you say, they're in Denver, why aren't they all coming in to do it? What's your take?
There's a couple of different reasons. Just based on talking with patients, it kind of breaks down to 5 things. One of which is they don't really know their options. Once you get dentures, you kind of disappear from the dentist, right? Unless there's sore spots around, and you need to go have it adjusted. Maybe if it gets loose, like I mentioned, the bone kind of breaks down a little bit over time. The denture gets a little bit loose. So with that, you'll have to get relines. So you have to kind of adapt it to your gums again. Okay, so that might be a reason to go in. But other than that, they don't go to see the dentist, and so they
don't know their options.
They don't have an opportunity to talk to the dentist about, can they get implants and the process and all the great options that we have available. The second reason why people don't come in is they still have kind of a bitter taste in their mouth with the dentist. They don't want to come back and see us, mainly because it was a money pit. I mean, it's, let's look back on their life in the last 10, 15 years
before they
dentures.
got a denture.
Yeah.
Okay.
And typically it's kind of a downward spiral. So you get sometimes a root canal. Okay, if you get a dental infection, you have a lot of pain, maybe you need a root canal. Okay, and that lasts for a little bit, and you get a crown on that, and then it breaks, and then you have to get a partial denture, and then that partial denture starts to wear and tear on the other teeth around it, and you start going downhill, and all of a sudden you end up in a denture, and you're looking back on your last couple of years, and you're saying, what a waste of time and money. And you get that denture, and you kind of have this sense of relief. You're free from the confines of the dentist office, and like I said, you're content. You've adapted to the denture, but you're not really happy. At least the patients that I've talked to.
You can't chew or like tear food, I guess apart.
Yeah. And sometimes food will actually get trapped underneath the dentures, and so that's really embarrassing. If you're at a restaurant or something like that, you have to go to the restroom to clean it out. And that can be embarrassing because people might come in and out of the restroom at that time. So these are the things that, I assume you don't have a denture. I don't have a denture.
Yeah,
so, we take this for granted. But these are the things that are in the people's minds kind of thinking, when they go out to dinner or go with friends, they have to think about these things. What can I eat? Do I have some extra adhesive? And all these other things. So the third reason, we talked a little bit about this before, but bone support and having enough bone around people's teeth, and maybe they've been told that they don't have enough bone to work with, or maybe they're too sick or too old to have these implants, which could be farther from the truth. And so with our office, we have a CT scan, we do exam, we kind of check it out, and with the CT scan, we actually look at how much bone they have to work with. So another reason why denture wearers really don't come in is they think that they're too old. And
how old can you be to do this?
Oh, you can be. I think my limit right now is 115 years. It might go up from now, but I think. Okay. How old's the oldest person, I think?
I don't know. So why would a 90-year-old or 95-year-old want to do this?
It's about quality of life. So I had my grandparents living with us when they were going through the last stage of life. And I know how much they appreciated those little things, which is usually going out to lunch and brunch with friends. And coming out with breakfast with family, getting together, and all those kind of circle around food. And so we're going out to restaurants or whatnot, and they just need to enjoy the food that they eat and the kind of the social interactions. And so if you can't, or if you have that hindered, you're thinking in the back of the mind, I need to worry about dentures and what I can eat. It just takes away from that experience. And so if you have implants and you know that these teeth are sound and stable, and you can eat whatever you want to, it's the joy that you have. And with that, you can eat better foods. So
more fiber.
More fiber, more healthy. And so a 95-year-old with a fixed set of teeth are going to eat more healthy. They're going to go out to social situations. They can hang out with friends again, which means they're going to get out and get more exercise, which, I would say would improve their life and probably improve their longevity as well, and enjoy life more so.
So you're the specialist, right?
Yeah.
Okay. It doesn't cost more to go to a specialist.
It doesn't, no.
To get this done?
No.
So you work together as a team. You and the general dentist get together, design the case, and your role is as the surgeon.
Right. So we did an additional 3 more years in training, really in improving the bone support and gum support and dental implants. So it's really, that is our specialty. Just like your MD, your primary physician, maybe works with a cardiologist if you have a heart attack, they'll send you away and they'll work with you as a team to try to manage both of those components.
So that's what you do there. Now, we've had your partner, Dr. Doug Heller, on the program here before. In fact, together they've been on my show side by side, Dr. Versman, Dr. Heller. So you're part of that team. Like you're the newest member of the team.
You can tell by my face. I'm a little bit younger. I'm
well,
older.
you've done like over 1,000 implants,
you
right?
Bet, yeah.
So
and I haven't gotten a single gray hair from it yet. So.
Okay. Do you think because you're younger, you're exposed to some of the newer things?
You know,
I mean, your training must be hugely different. You know, vastly different.
When I was meeting with Dr. Heller and Versman and joining their practice, part of the reason why I joined them was because I believed in their philosophies. And so in a lot of ways, we practice similarly together. So we kind of have the same philosophies. We want to treat patients as if they were family members. And so
now we're talking about denture wearers, no more dentures, attaching a full set of teeth to dental implants, okay? But the other group of people that have really bad teeth, bleeding gums, bad breath in their teeth, are, as you say, like kind of crumbling out. But aren't their gums too bad to do this?
Those are actually the best patients to come to the periodontist and to see us because we've specialized in both of those parts. So we can treat the gum disease with laser therapy, or if it's too far gone and doesn't make the sense, then we can start looking towards dental implants to restore them and get their teeth back. And when we remove the teeth, the bacterial infection goes away, and which makes it a great spot for dental implants, which are very successful after that.
Let's say somebody, they are headed to dentures, right? And they don't want dentures. They want teeth that don't come in and out, or snap in, snap out. Or they're a denture wearer. On that consult, what's discussed? What are their options?
Oh, there's a ton of options available. So here we can kind of start with the basics. So let's say we have a patient who's completely missing all their teeth. On the lower jaw, this is particularly important because there's no retention. There's nothing holding that denture in place at all. It's just flopping around. Some people go with adhesive. Sometimes that works, sometimes it doesn't. Having 2 implants right here and here, it really helps hold in the denture, and you can hear it kind of click, but it really holds the denture in very well. They don't need adhesive. It works well.
What could they eat with that?
You can eat lots of great different foods, more hard food. Still not as great
Could you eat like chicken and stuff like that?
Chicken, fish, for sure. Okay. Hamburgers.
Let me take a look at that. So this would be 2 implants. They get a full arch of teeth that just snap.
Full arch,
So I don't know if the camera can see that. So there's little snap holes on these teeth.
And you can actually use your own denture if you have one already in place.
Okay.
Or if you don't like it, you can always get a new denture that's made a little bit more cosmetic. And so
now, how solid is that too?
It is a lot better than where it was. Still not as good as having fixed. So the next option up is 4 implants and having different connections that hold in the denture. And this one is going to feel much more like it's rigidly fixed. You can eat a lot better food, like apples, carrots, all that stuff. This is your option for that.
So 4 implants locked in, snapped in, snapped out.
You bet. Lots of security. You know it's not going to go anywhere. And like I said, you can eat much harder foods with this option. The next step up from that is having a permanent set of teeth that don't come in and out. They just stay in there. And that's really what you're looking for. If you want to compare that to how your teeth were when you were 20 years old, that's probably the perfect one. And the patients that go from having a denture to having that, I mean, those are the people that really tear up and they realize what they were missing all those years. And
what could they eat, by the way?
They could eat apple. I mean, apples to me are the ideal, and maybe that's
front teeth they could bite out of.
Oh, for sure. And the people are going to have a hard time doing that, just mentally. They haven't eaten an apple in such a long time. They're gonna feel apprehensive, and you almost have to give them the apple and say, please eat this, because they're gonna shy away from it and slowly adapt to it. But really, shortly after getting those implants, they can eat into whatever you want. For me, it's peanut brittle and apples. Those are my things because I'm a bit of a sweet tooth myself. So
what about broccoli, or chewy foods like pizza?
Yeah. I mean, they're in there, they're not going anywhere. So.
And what's the maintenance once you get it done?
It's important to brush and floss it. Just treat it like your normal teeth. So you want to brush it, floss it, go in to have kind of the hygienist clean around that if there is any.
So like every 6 months they come in for
every 6 months. Plus, come in for some coffee, kind of get to know and get to see the staff again and the team and meet up and talk. And that's the other thing is I have one patient in particular that he went with dentures. He was very kind of a quiet man. Doesn't really open up very much, and he had dentures for years. And recently we got him some implants and fixed teeth, and he has just, he's opened up. He's laughing. He's telling stories, and really it's been a huge improvement, and it's always good to see him.
So you don't need an implant for every tooth. Is that what some people think?
That's what people think, but really just 4 to 6 implants and you've got a full set of teeth that don't come in and out. That's a life-changing experience right there.
You say it changes people's lives.
It does.
How so?
It does. So let me just paint you a picture on how the life of a denture patient based on my conversations with people. Like I said, they're kind of content. They're living their life with it, but in the back of their mind, they always have these things that they have to kind of change about how they live. They need to make sure that they don't have hard foods. They go to the restaurants that are going to be suitable for the soft foods.
Okay.
When we're thinking, I wonder, how tasty that apple or that steak is going to be. They're thinking, I'm going to have to get the orzo or the pasta salad to survive. And do I have that adhesive in my pocket to make sure if the denture does fall out, how to deal with maybe taking it out, doing some more adhesive and getting it back in there again. And so that really kind of, it hinders them. It almost takes away from their personality. They kind of shelter themselves a little bit more. In dating, for example, it's a dark secret that people don't know. Like I said,
dating with a denture.
Dating with a denture. I don't think there's a website yet on that one.
Okay.
But
it's got to make you feel insecure, I'm sure.
For sure. From what people have told me, it's not all older people that have dentures too. I have a handful of patients that are my age that have dentures.
Is that right?
It is. So, and some of them in particular grew up outside the country and didn't really have access to decent dentistry, and so they got dentures at an early age, and so they've lived with it for all these years. But can you imagine being 35 years old and not having a full denture and not being able to kind of live life and the way that you'd want to?
So are you of the opinion that really, at the top of the show we said no more dentures. Do you really believe that? Like nobody should be wearing traditional dentures? They should all be attached to something? What do you really think?
I truly do. The denture is a crutch that people use to survive. To me, it's a temporary. And anyone who's had a temporary partial denture knows it's not the best thing. And they're waiting for that time when they can actually have a tooth and eat whatever they want to. Dentures, to me, are that. They are a temporary solution, and really the implants are the only way to go to, get them, they can eat what they want, get their confidence back, get them out, living their life without having the worry of not being able to function, having that risk that the denture is going to fall out at some point. The other thing that I never really talked about was also eating. Okay, so we talked about types of food that you can eat with dentures. You kind of flop them around and they don't really grind very well. That's why you can't eat hard stuff. But also, there's a big piece of plastic in your mouth. And I'm thinking more of the upper denture than the lower. But there's a big piece of plastic that gets in the way of taste. And so people that have dentures don't really enjoy eating. And so by removing that palate, after you kind of get some fixed implants in there and hold that full set of teeth in there, you can actually remove the palate that goes on the inside, gets removed a lot of the plastic.
So to give them the upper, to remove that palate, how many implants, like for example, does it take?
Usually it's about 4 to 6 implants.
4 to 6 implants?
Yeah.
Full arch on the upper, don't come in and out.
Exactly, yeah.
It seems like they would want to do it. Because I know, look, Medicare, Medicaid does not cover this. Insurance will cover a small portion. I guess the best insurance, $1,500, $2,000 of it. Yeah. But you offer financing?
We do, yeah. We have several financing options available. And really, I think there's a misperception. People say, implants, and they already think, cha-ching, they're thinking money. Way too expensive. It's not one implant per tooth. And so like we talked before, 4 to 6 implants and you got a full set of teeth, okay? But also, most of my patients are not millionaires or billionaires. They are hardworking people. And so the difference is they look at it, they make a judgment on it, and they find the value in that, and then we make it work. And it's just like a car payment or a house payment. You can do monthly, and during those monthly fees, you get to live your life the way you should, with a fixed set of teeth, a beautiful smile, and really your life back again. A lot of people have seen the show, and they come in and they come in looking for teeth. And these are mainly men who come in looking for teeth to function, just to chew and eat food. I mean, they're kind of, I want something to eat so it doesn't fall out. And then we get them their teeth back and their smile and everything, and they go about their life. But then all of a sudden, a month later, they come back and they've already had, a dozen compliments about their teeth. And all of a sudden, they're becoming aware of how nice it looks. And their smile, I mean, people have trained their smiles to not smile like I'm doing right now.
You have a nice smile, by the way.
Well, it occasionally pops up every so often.
It's so funny. As soon as the cameras come on, you got serious. But you're a likable, nice, friendly guy with nice teeth.
I try.
Those aren't dental implants, though.
But these are muscles, exactly. These are muscles to try to get to smile. So it's just like those guys. Getting a smile takes time, takes effort.
So they actually end up liking the smile part of it more than the eating part of it.
And their smile gets bigger and bigger with time. I mean, it's, you ask them to smile before the very beginning when they get their denture, and it's like this. Within 6 months, it is all the way up, and you can see all the teeth.
So it's men and women that are doing this. And I thought it would be mostly women that are coming in.
It's all, men and women. It's about 50-50. So, and like I said, most of the men are looking strictly for function. But with all the denture technology and kind of changing how the plastic looks in the teeth, I mean, you can get these teeth to look beautiful and natural. I mean, people will come in and say, my old teeth, I had a little bit of recession right here. You can do that. Little spacing in between the teeth. You can. It's like so you could make
you could make the teeth look like their teeth used to look, where their friends won't even know.
Yeah.
So no more dentures.
No more dentures.
You want to wipe them out in Denver? You think?
I would
or in all of Colorado?
I would love to. Yeah. I think for the betterment of people's lives, it's better to just stay away from dentures completely.
People need to know, real interview, I'm not endorsing you on the show, but people always email us, or they've asked me over the years, who's your referral? Who should I go to? And I tell them, go to a specialist.
Yeah.
Go to somebody, this is all they do.
Yeah.
And if it doesn't cost more to go to a guy like you, teaming up with a general dentist, why not? Right?
Right.
And you guys have 3 specialists under one roof. Do you ever talk about cases together?
We all the time. So, we'll have 3 different computers on in one office, and I'll say, Dr. Heller, what do you think of this? Dr. Versman, what do you think of this? And we work as a team, really, to get the best results. And on top of the fact that we also run 4 or 5 different study clubs.
So you teach other dentists about dental implants all the time?
Yeah. So we, on a regular basis, probably once a week, we'll work an extra 3 hours, and we'll hang out with other dentists and prosthodontists and endodontists and orthodontists, and we all get together under one roof and talk about cases. And we show up a slide and say, how would you treat it? We have a lot of different specialists and different kind of niches of dentistry working together to say, how do you get the best result possible?
Now, denture wear or somebody headed to dentures, that means their teeth are bad. So in certain cases, you could do extractions and get their teeth right away.
Yes.
Is that right?
Yeah.
And they're eating it. Are they ever left without teeth?
Definitely not. That's one of the main rules of implant dentistry, is making sure that patients always have a tooth in place.
Okay.
And so we generally, will have the temporary in place already and in our hands before we take any teeth out. If we can do what's called temporization, so sometimes we can take the tooth out, put an implant in, and actually put a tooth on top of it. Now, that's a temporary tooth.
Okay.
But it still holds the space, looks beautiful for the time period until the implant fuses to the bone before you get the permanent one on.
But what about pain? It seems very painful.
It's not painful. Normally it's Advil, Tylenol afterwards. Most patients are good by the 3rd day. I mean, it's not difficult at all.
But during the procedure?
Not at all. So that's one of the main rules, is you are completely numb during the entire procedure. You don't feel anything. So you have the fear part of it, which is a little bit of, we can do some IV sedation or maybe some tablets to kind of calm people down, make sure they're relaxed. And then there's always the Novocaine. So no one's feeling it. And that combination makes for a very comfortable experience for the patient and for me. I love it when patients are comfortable. I shouldn't say they're most, but 80% of patients are asleep at some point during procedures. And I have
They
to
kind of
wake
doze
them,
off a little bit.
They doze off. I have to wake them up if they start snoring. It's not uncommon to have that done.
We're out of time. Final message. Somebody watching this, maybe they're still afraid or whatever. They're hesitant. They're either headed to dentures, their teeth are really just too far gone, or they're already wearing dentures, but maybe they're skeptical. What do you say to them?
I would say, implants and having a fixed set of teeth, it really is the way to go. It can transform people's lives. I've seen it, and I hope to do it, improve people's lives as much as I can.
What about the consultation? So they can call you directly? I know you're a specialist.
Yeah, you bet.
They can contact you directly?
We can contact us directly. We do consultations, get to know the patients. If they want to stop in for 5 minutes and meet me, that'd be great. Because it's a big decision, but in the end, it's life-changing.
Okay, good. I want to thank you for coming on the show.
You bet.
And we'll have your partner, Dr. Doug Heller, on the show as well. So thank you very much.
Thank you very much, Randy.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.